I am going to record this. None of you are in it. Just so that you guys can share it. We'll do question and answer, and I'll record it so that you guys can hear it. Okay, so I'm a little I'm Kaitlyn. I'm a pelvic floor PT at Limitless Physical Therapy. We're right down the road. You know where like Auction Direct used to be? We're across the street now. But I'm a mom of 2. I just had my second baby 3 months ago, and she's a beautiful baby girl. And then I also have a 2-year-old. So I'm right kind of for sure right now, and dealing with all the pelvic floor things as well. So, what I want to talk about today, and then I'll get kind of a feel of like if there's anything else you guys want to talk about. But the main things is incontinence, prolapse, and then diastasis recti. Those are kind of some big things. And then if you guys have any other things that you want to talk about, we can definitely talk about that as well. But with incontinence, there's 2 types of incontinence. We're going to focus on stress incontinence. So, stress incontinence is when your pelvic floor can't withstand the pressure that's placed upon it. So with coughing or sneezing, jumping, lifting something heavy, anything like that. Urge incontinence is more so I arrived home, I put the key in the door, and oh my gosh, I have to pee and I'm not going to make it. Or I see the toilet, or I'm pulling down my pants and I need a brush. We can deal with both of those things, but since we're not at Bootcamp, we'll talk more about stress, and then if you guys have questions about urge, we can also talk about them. So I'm going to have you guys think about your pelvic floor as an A-frame house. So in your A-frame, you have your attic, your main level, like kitchen, living room is on there, and then basement. We spend most of the time in the kitchen and living room, typically. So our pelvic floor should be active. It's a muscle, like any other muscle in our body. It's working, it's engaging, just as we walk or run or carry our babies, anything like that. And then we come up to the attic when we're doing like a heavy lift, or we're going to come up to the attic when we cough or sneeze. We may not think about it, but our pelvic floor is engaging and getting more of a contraction. So that attic space is more like your traditional Kegel. And then going down to the basement, we don't do that very often. That's mostly when we're having a bowel movement and bearing down. Even urinating, we shouldn't have to like strain or really bear down to urinate. If you are, then we have other issues. Like, hello, welcome. So with that said, now I lost my. So with that said, we're gonna really focus on, does your pelvic floor have the range of motion it needs? Does it have the strength it needs? And does it have the coordination? So if any one of those 3 things are wrong, then we're gonna probably have something happen, whether it's incontinence or prolapse or anything like that. So going back to our A-frame analogy, so if your pelvic floor is tight, that means that you're probably living up in that attic space. You're not down on that mid level. So holes are closing or narrower in that attic, and we're living up here. So it's harder for us to come either down to that main level function, or even go down to the basement. So things like constipation can happen, or not feeling like we can fully empty our bowels. And then if we're too weak, we're not able to come all the way up to that attic and get a strong enough contraction. And then sometimes there's the coordination aspect, and the coordination is more so you're not contracting when you need to contract, and you're not relaxing when you need to relax. So something we do in a PT session, and this is usually like at the initial evaluation or the visit after, we'll do an internal assessment, and what we'll do, it's super up close and personal, but we'll do a standing assessment. So I'll insert a gloved finger vaginally and then have you squat. And so if you bear down when you squat, we shouldn't be doing that. Our pelvic floor should be engaging more, so we should either be on the main level or up towards the attic. Then we know, okay, we need to work on coordination. So that would probably relate to, if you're leaking with squatting, then we're having more of a coordination issue. A lot of times that jumping, do you guys do double unders here? Or do you, yeah.
We're doing like this.
Yes. So like double unders are everybody's enemy. So that's more of a coordination thing. And a lot of us like tend to say, oh, I'm just gonna Kegel through this whole way, right? Like I'm gonna hold up into the attic the whole time. But then we're not giving our pelvic floor that mobility that it needs to take that impact. So if you think of like a water balloon smashing on concrete, like it's gonna smash a lot faster and quicker and harder than if it has more give like a trampoline. So we want our pelvic floor to be able to move and not be like holding up in that into the attic all the time. So with that said, I rarely, if ever, give out Kegels as an exercise. A lot of times we're like, oh, just do your Kegels or whatnot. And although it can be helpful, we'll usually pair it with an exercise if that's what you need in terms of like learning to coordinate your pelvic floor, or pairing it with a strength thing or like a cough or a sneeze. But rarely will we ever give out just Kegels, and it may end up being a range of motion issue and not actually a strength issue, and the Kegels could be potentially making everything worse. And that really depends on the person. Other things that can contribute to incontinence would be weak hips. So a lot of times weak adductors are a big one, and maybe we'll do a little test here in a minute. But or also jumping mechanics or lifting mechanics. So a lot of times if we just change and make sure that you don't think about jumping as like, oh, you need to have good form with this, but if you change your form doing double unders or single unders or whatever, that can make a huge difference as well. So usually we'll start there, and then if we need to address your pelvic floor, we'll do that. Do you guys have questions so far? I just threw a lot at you. Well, let me ask this. If you guys are brave, you're not on camera, so you can just raise your hand. Are you guys struggling, or does anybody have any issues with leaking with exercise? Okay, is that okay? So pretty much everybody at some way or shape or form. Okay. Is it more so jumping for everybody? Yes. Okay. So we'll do an activity, see if we can kind of figure some things out for you guys. See, we may need to, like, it may be something where you need a full evaluation. I can't do a full evaluation on you all today, but we can see if we can find something that may be helpful in terms of helping you guys be able to jump a little bit more. 40% of female college or high school athletes leak. So it's something that's like a huge issue, and a lot of times we think of it as like, oh, well, I'm a mom, or it's just normal, or everybody does it, right? Like everybody raises their hand. So, but at the same time, that doesn't mean that it has to be normalized, or it can be very common, but it doesn't have to be something that you guys are dealing with for sure. Okay. So for prolapse, we'll move into this a little bit, and then we'll hit the topics, and then we'll get moving. So prolapse is a weakening of your vaginal wall. So that could be whether it's in the front, so more so like bladder, or in the back, like more rectal, or it could even be apical at the top for like your uterus. It can also happen rectally too. I think it's, I wrote it down. Yeah, so 50% of women deal with prolapse to some degree. And a lot of times, especially in that fourth trimester, so like right after having a baby, in those first 3 months, a a lot of women deal with like some sort of pelvic heaviness. They may not feel like an actual bulge, you might, or anything falling out, but nothing is ever going to fall out. It's just that weakening of the lining. It was stretched a lot bearing a child, and basically doing hip strengthening, core strengthening, even just giving yourself time after being postpartum can really help not have some of those symptoms. But most women have like a first to second degree prolapse after giving birth and never really know it. So you may have some of those objective signs, and sometimes you might not have anything objectively. It's just like the subjective of every time I run, I just feel really boggy, really like I get heaviness in that area. So really just learning to manage pressure can be really helpful. So I'm going to give you another analogy. So I'm going to have you think of your core as a can. So at the lid of that can, you're going to have your diaphragm. At the bottom of the can is your pelvic floor. In front, we have your transverse abdominis, which is your deepest core muscle. So not like rectus that's helping you do sit-ups, but really your transverse abdominis runs horizontally, gives you a good core brace and stability. It's not much of a mover. And then back rotators, again, more of a stability muscle than so with that can, if you were to shake that can up and hold your breath while you're either doing exercise or you're pooping, really straining, anything like that, pressure is going to leak somewhere. Giving birth is a great example in terms of you're pushing a baby out, there's a ton of pressure, and it may leak at some point. So whether that's your diastasis recti, which we'll talk about in a little bit, or whether that's your pelvic floor, then any prolapse can happen. It's really learning to like manage pressure within that canister can be helpful. So as your diaphragm, as you take a deep breath in, your diaphragm's going to move down and same with your pelvic floor. So that inhale puts your pelvic floor more on stretch, and then as you exhale, that diaphragm and your pelvic floor moves up. So it's kind of moving like a jellyfish all day long. Not a ton of movement. Now if you take a nice big deep diaphragmatic breath, you're gonna create more movement within the can. But we can use that to our advantage with exercise. So, and this can also help with leakage as well. So I know like I'm putting this in the prolapse part of the section, but it can help with leakage. So by exhaling, we're letting air out of the can. We're taking pressure off of our pelvic floor. So like let's say you're lifting something heavy, exhaling will help just engage your pelvic floor a little bit more. Then you could also add a Kegel into that. So if you're having issues or heaviness or leakage or any symptoms when you're lifting something, engaging your pelvic floor by doing a Kegel and then exhaling, now we're letting pressure out of that can. That exhale is also helping engage the pelvic floor, and then we're adding that little bit of extra muscle contraction just to give more support. That can be helpful. Does that make sense? Usually I have a whiteboard when I say all this stuff, so I feel like I don't have drawings, so it's harder. So with that, running can be a really like typical time where people start to feel heaviness, or lifting or exercising. I know for me personally, postpartum, like that was weeks. I'm much better now, but weeks of feeling like I run 2 steps and I'm like, oh, that just does not feel right. But what we use as a big signal for like that you guys can take and apply is if you're feeling that heaviness, it's probably saying it's either too much or that we need to take a break, as in your pelvic floor is tired. So if you're feeling heaviness, then we probably need to modify the exercise or apply some of those techniques that I just taught you, like the exhaling and engaging your pelvic floor can be helpful. If you can do it with those extra techniques, or even just like changing body mechanics, then go ahead and keep running or lifting or whatever it is. doing something else, how runners who are dealing with this a lot is, let's say you start to feel heaviness at like half a mile. So run 0.4 miles right before that point of feeling heavy, then walk for, I don't know, 0.2 or 0.3, whatever rest break you need, and then start running again, see if you can run another 0.4. But you're giving your pelvic floor a break in between. Same thing with leakage. So if you're, you can run a mile, but like past that mile, then you're leaking, and then you need to start building up some of that endurance. So you take that rest break, stop right before that like verge of symptoms, like, oh no, I think this is kind of the point, and then whether it's a walking rest break, a different type of exercise, or a true rest break, like sit on the bench and then go back and do kind of more like an interval. Okay, so, and then for diastasis, so this is like a really big hot button topic that you guys are probably seeing all over social media, and it freaks a lot of people out. I'm like, I have no idea if I have diastasis, all of these things. So 60 to 80% of women have diastasis in postpartum. 100% of women have it while they're pregnant. So this is something that is very normal. It's really just a stretching of your linea alba, which is like the ligamentous tissue between your abs. And in order to make room for baby, it's going to stretch. Now, the other crazy thing is 50% of the general population has some form of diastasis. So that means our like men with beer bellies have diastasis as well. However, just our culture and social media has really honed in on women. There's no guy out there that anybody's telling like, oh, don't do a sit-up because you're gonna make your diastasis worse or anything like that. So it's really pretty normal to have some form of like widening the gap. And for a really long time, we've been focused on widening or narrowing the gap. So a typical exam to look at diastasis is we're palpating your linea alba to see how wide that gap is. And it's very much focused on like that measurement, like, oh, is it less than 2 centimeters, then you're okay. If it's greater than 2 centimeters, then you're not. But really what the research is showing and where we're like headed is looking more at the function. So if you're, when we do that same assessment, now I don't care as much about like how wide is this gap, because I know that most of my mamas are gonna have some sort of lengthening there, but is it functional? Can you get a functional brace? So when I palpate, am I looking like, is this boggy? Is it kind of squishy? Are you getting, you're not really contracting your core well through the gap? Or is it firm? Like, are you able to have good pressure within that canister that we were talking about earlier, where you can get a good core brace, even though your gap may be 4 centimeters, then we don't really care about having the diastasis. So it's really more focused on function. The other thing is that there has not been any exercises proven to make diastasis worse. So all of the like exercises that you'll see on Instagram or TikTok that's like safe for diastasis recti, they're like, it's not research based in terms of, oh, this is actually safe or this is dangerous for it or something like that. So we really are trying to like take the fear away, because there's a lot of times women are just like won't exercise or they won't do something because they're nervous about that. But if you're able to get a good functional core brace, that's really what matters more so than really trying to focus on the width, because it is normal. It's what our body should be doing to make space for baby. And there is also the like more cosmetic aspect. So like there's things that we can work on if it's more cosmetically. Some you're going to see a lot more if you're wearing a bikini versus others, and so that can be really important for women too. But in terms of exercise, unless you're having symptoms with like your diastasis, then and you're able to like maintain that functional core brace, then like go ahead and really do anything that you want. The other thing too is in daily function, we are doing a sit-up with the baby on our chest when we're trying to get out of bed. And we're having to do those tasks anyways, getting up and off the ground. And it really depends, like strain on your body, whether it's your pelvic floor or your abdomen, is relative to the person. So for somebody, getting up out of a chair may be really difficult, and they're, have to use their arms, and that puts a lot of strain on their abdomen. For somebody else, like probably most of you, getting up from a chair, it's causing no strain whatsoever. So it's the same thing with exercises. We use very much like a graded approach, whether if you're more physically fit, then we can definitely progress you a lot faster, and it's a lot less strain on your body versus somebody who's more conditioned. Okay. I think anything that you guys want to add or questions about? Yeah.
What are some symptoms of diastasis?
Yeah. So one symptom, anything pelvic floor related, so you can get like the heaviness, incontinence if you're not managing pressure well. And then it can also just be pain, feeling like you're like just a strain kind of, mostly those kinds of things. I don't see too many people come in for like, oh, I have all these symptoms with my diastasis. It's more so just like concerns about it. Yeah, I don't see symptomatic diastasis very often. Yeah.
Okay.
So back to the first one, just like the weakening of the muscles that don't reverse, probably considered would be
Prolapse.